severe chest pain, breathlessness and vomiting. He could be rushed to the hospital 5 hours 5 hours after the onset of chest pain. His blood was immediately drawn and the laboratory investigations are CPK 600 unit per liter, aspartate transaminase 85 unit per liter, lactate dehydrogenase 315 unit per liter. Further laboratory investigation was done and the CPK2 and LDH were highly elevated. Then it may be suspected. What is your probable diagnosis? Why? We are telling microarterial infarction. That is correct, microarterial infarction. Why? Okay. Markers, biomarkers or enzyme markers of myocardial infarction. Which is the most important enzyme? AST. Which is the CPK has how many isoenzymes? 3. CPK 1, 2 and 3. That enzyme CPK, creatinine phosphokinase, or also called as CK, creatinine kinase. So CPK, what is the role of CPK? What converts to what? Phosphocreatine will convert it to creatine by the help of enzyme CPK. So this enzyme will be increased, and out of that, how many subunits are isoenzymes are CPK 1, 2 and 3? Out of that, which one is more important for the who will increase? CPK 1 or 2? CPK 1 or 2? Why silent? CPK 2. 2 will be increased. And what is the time? Time bound? Within 4 to 6 hours. So that's why first you keep the point here, 5 hours after the onset of chest pain. Okay. This will be here. Starts to rise will be within 4 to 6 hours, and when it will peak elevation 24 hours to 48 hours, and in days it will be 3 to 5 days. AST level aspartate transaminase will be 6 to 8 hours, and it will increase. Peak elevation will be there 1 to 2 days or 24 to 48 hours. Then 4 to 6 days will be, it will be the level will be there. Then LDH will be increased 12 to 24 hours. How many isoenzymes of LDH? LDH? Isoenzymes of LDH? 5 isoenzymes. What are these? 1, 2, 3, 4, 5. Okay, very good. 1, 2, 3, 4, 5. So out of that, which one is increased in myocardial infarction? Already answer is here. Which one will increase? 1. So in electrophoresis you have already also read LDH. What is the role of LDH? What will convert to what? Lactate to pyruvate or pyruvate pyruvate to lactate. Both will be converted. Both will be by the LDH. So LDH1 will be highly increased. In electrophoretic mobility, in electrophoresis, the which will go faster? Fastest move out of 5 enzymes, LDH1 will be fastest. So now little bit already you know. So suppose this case came. So first it will be keep in mind the time when chest pain started. What is the time and the different ranges of the plasma enzymes. Next is another case. A 45-year-old male presented to the orthopedic OPD with history of pain and swelling in a big toe. On questioning, he gave history of occasional such pain, particularly after a party the night before. He is a social drinker. On examination, the big toe and ankle looked swollen, red and tender. His blood test showed uric acid level will be 9.6 mg per dl. Gout. Very good. Yes. It is a case of. Yes. Then what is the normal level of uric acid? Uric acid normal level. Normal level of uric acid. It is a case of male. Normal level of uric acid up to 6 or up to you can tell 7. 6.7 mg per dl. So it is increased. So it is a case of gout. Now the probable diagnosis is a case of gouty arthritis. Now you tell what drugs you will give. What will be utilized? Allopurinol. Very good. That is allopurinol. What it will do allopurinol? Very good. It is a competent inhibitor of xanthine oxidase. What is the role of xanthine oxidase? Role of xanthine oxidase. What it does? Xanthine oxidase. Which synthesis will block? Our target is to decrease the synthesis of uric acid. Decrease the synthesis of uric acid. That means catabolism of purine will be blocked. Catabolism of purine should be blocked by the allopurinol. First, so hypoxanthine converted to xanthine by the xanthine oxidase, and xanthine will converted to uric acid by the same xanthine oxidase. So that first when alloxanthine or allopurinol will give, that will inhibit to the first one xanthine oxidase, first one hypoxanthine to xanthine. That will be what it will convert? It converted to alloxanthine, and that alloxanthine will more potent inhibitor of the next xanthine oxidase. Okay? Okay or not? So allopurinol will inhibit the xanthine oxidase. After inhibiting, it will form the alloxanthine. That alloxanthine again it will be potent inhibitor of the xanthine oxidase. So synthesis of uric acid will be blocked. Okay. In X-ray, what you will see? X-ray of synovial fluid. What you will see? What you will will you observe? In X-ray, already I have discussed. Which crystals? Huh? Which crystals? Huh? Huh? Yes, monosodium urate. Yes. So, sodium urate crystals will observe in X-ray. Now, tell one question. What is pseudo gout? Yes, that is correct. What is that? What is the difference between gout and pseudo gout? Huh? Huh? What is the difference? In gout, you will see what is the sodium urate crystals will be deposited, and pseudo gout, what elements will be deposited? Instead of, yes, yes, tell, calcium pyrophosphate. Very good. That is calcium pyrophosphate. Phosphates. Instead of sodium urate, you will get the pyro crystals will be deposited. Another case study, a 4-year-old boy showed signs of learning disability and aggressive behavior. Besides pain in the joints, it was observed that he had an irresistible urge to bite his fingers and leave. The laboratory investigation revealed that the boy had serum uric acid concentration of 10 mg per dl. What is that? Huh? Yes, that is case of Lesnian syndrome. Very good. Case of Lesnian syndrome. Okay. Why that uric acid level will be increased? In that case, Lesnian syndrome. In Lesnian syndrome, why the level of uric acid will be increased? Yes, due to deficiency of which enzyme? That is HGPRT. HG. Hypoxanthine guanine phosphoribosal transferase. What is the role of this enzyme? Synthesis of huh? Synthesis of what? What is the role? What is the role of this enzyme? What converts to what? Yes, synthesis of ionosin monophosphate. Huh? Everything vacated. Huh? So hypoxanthine will be converted to IMP or guanine is converted to GMP by the help of enzyme, that is HGPRT, hypoxanthine guanine phosphoribosal transferase. So if this enzyme will deficient, hypoxanthine HGPRT deficiency, so what will happen? Suppose this enzyme deficiency is there, what will happen? What will happen? If this enzyme deficiency is there, what will happen? That means it will be So utilization of hypoxanthine guanine will be reduced, and accumulation of what? This is the PRPP, phosphoribosyl pyrophosphate. Phosphoribosyl pyrophosphate will more and more accumulated. Then it will go for which pathway? Which pathway? Which pathway it will go? What is the role of this PRPP? Role of PRPP, phosphoribosyl pyrophosphate. Role of PRPP. It will helpful for the synthesis of purine synthesis. More and more purine will be synthesized, and if more and more will be synthesized, that it will go for more and more degradation. More and more degradation. That means level of uric acid will be increased. Okay. Are you remembering or not? Okay or not? That time when I took class, I told mechanism is twofold mechanism. Another case study, a 62-year-old CEO, Chief Executive Officer, reported in the urology OPD with complaints of increased frequency of micturition, weak urinary stream, occasional episodes of hematuria, constant back pain. A digital rectal examination showed that the patient had enlarged prostate gland. What will be your provisional diagnosis? Prostate? Prostate cancer. Very good. That is case of, it may be a case of prostate cancer. Then which enzyme, what will investigation, what will investigate? What is the marker for prostate cancer? PSA. That is PSA. What is that PSA? Prostate specific antigen. So what is the normal level? PSA normal level? Normal level of PSA. Less than 4 nanogram. So in this case, it will be increased more than 4. Okay, most important the prostate specific antigen. Also you can do acid phosphatase, ACP. But compared to ACP, PSA is the most reliable marker. Okay. In case study, both sides should be discussed. Okay, little bit got knowledge or not? কিছু কিছু বোঝা পড়লো? This is the last case study. A 55-year-old woman, a patient of tuberculosis, was given the drug isoniazid. At the end of the treatment, she developed neurological manifestations such as depression, irritability, nervousness and mental confusion. Her urine content increased of concentration of xanthurenic acid. Why this happens? Huh? Xanthurenic acid related to which metabolism? Which metabolism? It is carbohydrate or protein or lipid? Protein, very good. That is amino acid metabolism. Which amino acid? Huh? Tryptophan, very good. Tryptophan. This is the tryptophan. That means in tryptophan, that means tryptophan metabolism will blockage of the tryptophan metabolism. So as a result, that xanthurenic acid will be more and more excreted. Okay. Now we tell, this is okay. Now we tell why this happens, neurological manifestations. Why this happens? Why the neurological manifestations occurs? Due to this drug, it causes, it is a case of drug induced vitamin deficiency. Which vitamin will deficient? Which vitamin? Which vitamin? B6. B6 will be deficient. So in this case, what you have to do? Supplementation of B6 you have to give. Okay. Okay. So thank you all. Be ready for examination.
All right, so we are coming to the fag ends of anatomy course. Almost over. We are dragging it anyways. So we are going to talk about some contents, which is the basal ganglia, and very few times we see a theory questions coming on it. We see most of the times the basal ganglia, the nucleus system, is given on more or less in the physiology session because it has more functional aspect than that of this anatomical aspects. But anyways, we have to correlate this anatomy with the physiology and the related things, which will be like followed accordingly. And in practical as well, of course, we have to understand this basal ganglia, some parts of it. So I'll be just like going through, not taking too much of like attentions on these particular regions. So, but again, we have to learn about this particular component which you're going to see. The basal ganglia or basal nuclei, the new terms, is basically whatever we are going to learn or going to talk about is the collections of these gray matters which is placed inside the deep brain substance. So these substances, they are not present on the sides or margins, they are present in the deep inside. If you cut down and see inside of these more medial aspects of the brain, we are going to see these collections of the cell bodies. We call them as basal ganglia, which was the old name, misnomer. The collections of the cell bodies, we call them as basal nuclei. So to start with this, we are going to talk about this basal nuclei, basal ganglia, what they are composed of, consisting of, what are the functional or what is the importance of them, and what if we have the loss of functions on them, which is a more clinical aspects to deal with in related to the basal ganglia or basal nucleus is concerned. So that's the plan for the day, and we'll just like move through. And the sections of the brain which basically reveals this nuclei, which is known as horizontal section. So, we cut the brain through this sagittal section, like splitting the right half of the brain, left half of the brain, but that does not expose this ganglia. If you cut this brain from right to left, that means horizontal section, only then we can see these particular collections of the cell bodies, which is placed deep inside. So, then we move into it. So, basal nuclei, basal ganglia, as I am saying, they are kind of like collections of the cell bodies. Rather than anatomically they are linked, they are more importantly linked in as far as physiology or functional is concerned. Now, they are not present as a single anatomical unit. That means they are not present as an organ, like we have seen the liver, that was, we have seen this particular like a heart, which is present as an organ. They are functioning and the presence as an organ itself. But this particular basal nuclei, they are scattered. They are present in different locations, and from different locations they are giving inputs, and giving different inputs they are doing and same job or same work together and bringing out the same result. And that is why we are clustering them as a collections of the neuronal bodies, we call them as basal nuclei. Now, part of this particular basal ganglia, which is we are saying they are present in the deep brain and spread it across. That is what you are talking about. Once we just like narrate them, it comes more meaningful as to about why they are calling it a deep substance and why we are saying that they are spreaded in different parts of the brain component. So, if you look at this particular anatomical component of these basal nuclei, anatomically and functionally, we have two different entities. So, anatomically we see that there are three nuclear collections there. We call them as corpus striatum, which is the prime content of the basal ganglia or basal nuclei. And then we have this amygdaloid body, which is another collections of the cell, which is smaller in size and shape. And we have another cell, we call them as claustrum. These are the three functional units of these particular, three structural unit of these basal ganglia nuclei. They are present in the deep substance of the brain. Along with that, we have some additional parts of the brain which also continues or work likewise to the basal nuclei. They are known as functional component of the basal ganglia. They are known as substantia nigra and subthalamus. Now, as I am saying, they are spreaded across. So, this particular component, which is anatomically linked, they are present in the substance of the brain, which is related to the telencephalon or the mid portions of the brain. Rather, substantia nigra and this particular subthalamus, they are present in the lower part of this brain. Substantia nigra even lower, they are present in the brain stem. So, that is why I am saying these basal ganglia or nuclei, they are spreaded across and present in the deep substance of the brain. Now, coming to this particular morphological aspects, coming to this particular nomenclature, we just talked about this particular anatomically have three nucleus. So, three nucleus over here is corpus striatum, which takes the maximum load in contributing the basal nuclei. Now, this particular corpus striatum is composed of two different cells of nuclear bodies. One of them we call them as lentiform nucleus, other is known as corded nucleus, and they are separated with this green fiber which you see here. They are in between this lentiform nucleus and this corded nuclei. We have a fiber running between them. We call them as internal capsule. So, they are separating this corpus striatum into splitting into two parts, lentiform nucleus and a corded nucleus. And again, this lentiform nucleus is again divided into by another fiber system. We call them as medullary fibers. This particular medullary fiber splits this lentiform nucleus into globus pallidus and the putamen. So, these are the structural part or anatomical, gross anatomical things about this particular basal nuclei which you see here. So, this corpus striatum is again split into these segments. Now, if you take this particular corded nucleus and the putamen, they are likewise and work similarly. So, that is why these two components of this particular putamen and the corded nucleus, we call them as neostriatum. And again, this globus pallidus, they works along, we call them as pallidum. So, this particular classification, so that we have to know about, remember about this thing. This chart basically, you have to remember about this particular anatomical aspects of the globe of this basal ganglia. So, it is composed of the corpus striatum, amygdaloid body and this rostrum anatomically. Along with that, substantia nigra and the subthalamic nucleus, which are functional components. These are five things together. Now, splitting down or zooming out this particular corpus striatum, which is a bigger aspect, It is separated by a fiber which is known as the internal capsule into two components of the nucleus cell. We call them as lentiform nucleus and the caudate nucleus. And again these two components, the lentiform nucleus is again split into two parts, globus pallidus and the putamen by some fibers again into this. Now this caudate nucleus and the putamen, they have the same color code used over here because they are constituting a common factor or common force. We call them as neostriatum, also known as striatum, and rest part we call them as pallidum, which is composed of these globus pallidus fibers. So this is about it. Now that's like a digging deep into it. This is what we are talking about. Now this particular picture you have to just like a memorize. Now this is a picture which is a schematic picture, of course. It's a deep brain picture, whatever you are seeing here. Now brain is cut from right to left and you are looking the person from the top, and only then you can see this particular cross section picture. Now this particular thing exposes this particular basal ganglia. If you are seeing that from medial to lateral, you have to just like reflect. The most medial we will be seeing the ventricular cavity, the lateral ventricle, and then you just like move along, then we are going to find this particular content. Now this particular area of the basal ganglia is lying lateral to the thalamus. So we have the midbrain, the ventricle, then you have the thalamus, and moving to the lateral aspects of the thalamus, we are going to see this particular collections of the cells, which is the basal ganglia cells. So this region is a midline, which we have this particular corpus callosum split, and then you can exposes this particular cavity of the lateral ventricle, and then this large mass of the nuclear bodies we known as thalamus. Now lateral to the thalamus, we have this particular house of these collections of these neuronal tissues, which is the gray matter, of course. We call them as basal ganglia nuclei. Now this particular basal ganglia, as I am saying, this region we call them as corpus striatum. Now corpus striatum is split into this gray tissue, which is a kind of fiber, which is known as the internal capsule. We learn about the internal capsule, the different parts of it, like anterior limb, posterior limb, bend, which is the genu, etc., etc. So this particular ascending fibers of this particular system of these internal capsule, splitting this corpus callosum, almost splitting completely into two parts. This medial part we call them as caudate nucleus, and the lateral part, which looks like a lens, we call them as lentiform nucleus. So these caudate nucleus, where I am rolling it, and this caudate nucleus, they are composing of the corpus striatum, and they are spreaded from each other by this running fiber, which is the anterior limb of this internal capsule. All right. So this is the positions of this particular deep nucleus, basal ganglia, corpus striatum. Now, getting into from the corpus striatum to the individual content. Now, we are going to talk about this caudate nucleus first, then we are going to talk about the lentiform nucleus, and then claustrum and amygdaloid body, and then substantia nigra subthalamic nucleus. So, from this corpus striatum, we are going to this particular caudate nucleus. So, caudate nucleus, it looks like a comma shaped structure, C-shaped structure, which is present on the lateral side of the lateral ventricle, or on the sides of the lateral ventricle. The red shadow, which is basically denoting the positions of the corpus caudate nucleus. Now, if you just like describing it, it has a head, it has a body, it has a tail, which is arching back around this particular lateral ventricle from front to back like this. So this is the different parts of the caudate nucleus. So this particular thing you cannot see it. Only you cut the brain from here, separate the two hemisphere, then cut it from the right to left, then seeing from the top you can expose this. So this is a specimen what you are seeing here. Looking from the top you can figure it out the positions of the caudate nucleus or part of the caudate nucleus which is present on here. Here in the anterior part is the caudate nucleus. And if you want to see this whole, oh sure, go ahead. So this intersections of the caudate nucleus cannot be seen in a single section. So this C you cannot see it like this. So this particular caudate nucleus, if you are making a section, this head of this part of the caudate nucleus which is present on here like this. So this is the head of the caudate nucleus or caudate nucleus you are seeing in the anterior end, and this is the lens which you are seeing here, the lentiform nucleus. Between the caudate and this lens we have the running fibers of the internal capsule separating between them. So this is the orientation of these caudate nucleus. C-shaped structure present around the lateral wall of the lateral ventricle, have got three parts, head, body and tail. That's it. So, this chordate nucleus is separated from the lentiform nucleus by these particular running fibers, which is known as internal capsule. Now, from the chordate nucleus, we are going to talk about the lentiform nucleus, which is present on the other side of this lens. So, this particular lentiform nucleus, which looks like a lens, is composed of two components, globus pallidus and a putamen, which is separated from the chordate nucleus, of course, the same fiber, internal capsule, which is separating between them, and they are lying more deep compared or more ventrolaterally or laterally to this particular thalamus, which is present in between them. So, this particular thalamus and this particular lens structure, which you see here, globus pallidus and putamen, which is basically lentiform mucus forming over here, is present in here. Now, getting down to the two substances of the lentiform nucleus, what is known as the putamen and the globus pallidus. So far, I just remember yesterday we talked about this particular two component, globus pallidus and putamen, and while discussing, I may have switched the positions of this particular putamen and the globus pallidus. So this particular putamen out of this lentiform nucleus is present on the lateral side, and the globus pallidus present on this particular medial side, which is close to this particular thalamus. So, narrowing down or zooming down this particular lentiform nucleus, we focus at the putamen, which is the larger part and the laterally located part. So, this putamen, which is deeply stained over here, we can see that like a deep mark over here, we call them as putamen, which is present on the lateral side, and this particular putamen is separated from this particular globus pallidus by a thin layer of white matter fiber. We call them as medullary lamina. So, between this putamen and the globus pallidus, which is other part of the lentiform nucleus, we have a very thin strip of tissue of white fiber runs here. We call them as medullary lamina, separating between them. So, this putamen, lateral larger part, darkly stained compared to this particular medial counterpart of this particular lentiform nucleus, they are present on this. Now, coming from the putamen, we have this globus pallidus, which is palely stained, present in the medial half. Between this particular putamen and this globus pallidus, we have a white matter fiber. We call them as medullary lamina, which is splitting between them. So, this is about this particular lentiform nucleus. Have got two parts, lateral part, medial part. Lateral part darkly stained, which is a larger, broader part, which is known as putamen. Medial half, we call them as globus pallidus, which is close to this thalamus, and this particular putamen and this globus pallidus, in between them we have a very thin white fiber running, separating between them physically, which is known as this particular lamina, which is known as medullary lamina, separating between them. So, this is about this particular corpus striatum, that is consisting of two components, chordate nucleus, lentiform nucleus, and spreaded each other by this fibers, which is internal capsule, and in between putamen and globus pallidus, we have a separating fiber, which is known as medullary lamina, which is splitting between them. Now, coming from this particular corpus striatum, the other parts related to this particular like a basal ganglia, we call them as claustrum, which looks like a claw. Now, again, we are seeing this particular picture, which is a horizontal section. This is the horizontal section, we are looking at it. We have the chordate nucleus, which is placed over here, the red. This is the large mass gray matter, which is thalamus. In between them, we have this internal capsule fiber, which is running between them. The green and the blue is the putamen and the globus pallidus over there. Now, if you just mark lateral from this particular lentiform nucleus, the putamen is the green mark shadow. So, just like lateral to this particular green mark, which you are seeing here is the putamen, we have a thin white fiber running between them. The thin white fiber running just lateral to this particular green shadow, which is the putamen, we call them as external capsule. So, this particular external capsule is a white matter, which is present lateral to this putamen. Now, if you go farther lateral, you find another shadow over here, which is collection of another gray matter. And this particular gray matter collection looks like a claw. We call them as claustrum, which is another anatomical component of this basal nuclei, which is known as claustrum. So, we have to know these orientations, how they are placed inside to outside. So, we know this particular thalamus, we have this internal capsule, then we have this globus pallidus, then we have the putamen, then we have this external capsule. What is external capsule? It's a white matter. Then it's a gray matter which is known as claustrum. If you go farther lateral from the claustrum, you move laterally farther, you find another white matter fiber. We call them as extreme capsule. So, this orientations is the thing that we see in a sectional view, horizontal section in anatomical specimen. So, we ask you to identify this particular nucleus which is present in it from medial to lateral and lateral to medial. The sequentially you have to know, and what this part we are seeing here is the basal ganglia or the basal nuclei which is present in the here. So, medial to laterally, caudate nucleus, thalamus, internal capsule, then we have this particular globus pallidus, putamen, external capsule, claustrum, extreme capsule. That is a sequence of these structures which you are seeing here. So, this is composed of the anatomical component of these basal ganglia. Now, we are moving to the functional component which is additional to, which is the amygdaloid body, or another component which is amygdaloid body, which is the structural component of course to the basal nuclei, which is looks like almond. Now, this particular almond is present in this particular like lateral ventricle, and in the part of the lateral ventricle, if you just like move these anterior aspects of the horn of this particular and inferior horn of the lateral ventricle, you find this particular collections of this body which is present in here, which is known as amygdaloid body. And if you look at this temporal lobe, and the temporal lobe has a projection, we call them as uncus. The uncus is related to the parahippocampal gyrus, that region. We talked about this particular inferior surface of this particular brain. Then we have a bend over there. We call them as uncus, which looks like a hook. So, the uncus is basically the positions of this particular amygdaloid body. Now, this amygdaloid body is developed from the same source with this particular rest of this basal ganglia nucleus. But this particular amygdaloid body functionally is not related to the basal ganglia. So, this amygdaloid body having a same developmental source, but functions in the different office, we call them as limbic system, which controls this particular like emotional content of this particular like emotional part of our cerebral content or emotions control over there. So, the amygdaloid body is another component of this particular anatomical component of the basal ganglia, which is present related to the uncus part of the temporal lobe, which is closely related to this particular inferior horn, the lateral ventricle anteriorly and little bit on above on that part. Now, this composed of this particular three component of this particular basal ganglia nuclei, which is anatomically related. We call them as corpus striatum, then we have this particular claustrum, and then we have this amygdaloid body. These are the three component. Anatomically, we see this basal nuclei. Now, other than this, we have these two functional components. We call them a substantia nigra and the subthalamic nucleus. So, these are functional component of the basal nucleus. Substantia nigra is of course the most interesting part amongst this particular basal nuclei is concerned, which is present in a midbrain. And in a midbrain, this particular nucleus is housed, but there are fibers reaching to this particular middle portions of the brain. We call them as substantia nigra. And other than these, between the substantia nigra and this particular telencephalon, we have a collections of these nucleus which is lying below the thalamus. We call them as subthalamic nuclei. So, these are the functional part of this particular brain component or this particular basal nuclei which you have started to discuss about the basic classifications when we are coming to it. So, basal ganglia, corpus striatum, claustrum and amygdaloid body, these are anatomical component, and additional to it two functional component which is related to the basal nuclei or basal ganglia, substantia nigra and the subthalamic nucleus. Now, from here we are going to talk about the connections which is related to this point. Now, there are two connections which are related to this particular basal nucleus. Some of the fibers are coming in to this particular basal nuclei. We call these connections which is coming in, we call them as afferent fibers. So, whoever the fibers are coming in to the basal nuclei, we add the word as striate fibers. So, majority of the fibers which are coming to the basal ganglia, they are from three sources. They are coming from the cerebrum or the cerebral cortex, they are coming from the thalamus, and they are coming from the brainstem substantia nigra. So, from three different sources, the fibers are coming and ending on the basal nuclei or precisely corpus striatum. Now, wherever the fibers or wherever the source it be, coming from the cerebral cortex or this particular brainstem or the thalamus, we add the word as striate fibers. So, if these fibers are coming from the cortex, we call them as corticostriate fibers. They are coming from the cortex ending on the corpus striatum. We are taking it together, we call them as corticostriate fibers. They are coming from the thalamus and ending on the corpus striatum, we call them as thalamostriate fibers. And coming from the substantia nigra, we call them as nigrostriate fibers. And of this, nigrostriate fibers are climbing fibers. That means from the cortex they are going down, from the thalamus they are going down or moving horizontally. From this particular midbrain, they are climbing up. So, these particular fibers, which is nigrostriate fiber, which is climbing fiber coming from the midbrain getting to the striatum. Now, out of these fibers, the point of interest circles on these nigrostriate fibers, because these are the fibers which is coming from this particular substantia nigra, which is containing this neuromelatonin, which is the powerhouse or the synthesis point for the dopamine fibers, and through these nigrostriate fibers, the dopamines which is synthesized in the substantia nigra that travels through, and they are the controlling things about this particular the functions of this basal ganglia nucleus. So, these are in-house fibers. There are some fibers which are going from this basal nuclei going out, we call them as efferent fibers. So, there are very few efferent fibers which are related to it. So, efferent fibers which is going from this part is mostly going from the globus pallidus and the substantia nigra. So, the efferent fibers they are very less. They are going from these, they are going from the globus pallidus and substantia nigra. So, based on this, how the fibers are coming in or going out from this particular component, there may be this nucleus system can be classified accordingly. So, it can be classified as input nuclei and output nuclei, and in between them intrinsic nuclei. So, input nuclei, that means most of the fibers are coming into this basal ganglia and ending in some nuclei, and some of the basal nuclei are shooting out some fibers out of this, which is outgoing fibers. So, input nuclei which are receiving this particular striate fibers, which are related to this corpus striatum, mostly they are ending on caudate nucleus and the putamen, whereas this globus pallidus and substantia nigra, they are just like releasing the fibers from them. They are known as output fibers, and in between them we have this particular subthalamic nucleus, some parts of the substantia nigra and the globus pallidus, they are intrinsic fiber, they are just like interchanging fibers. So, based on this, how the fibers are coming in or going out, there could be and possibly the input fibers or input nuclei, output fibers and output nuclei and interchanging nuclei. There could be another classifications of these particular basal nuclei could be possible. So, two possible classification we just talked about. One is the anatomical classification, there is functional classification, and based on the fibers how they are ending on the different nucleus, there could be another classification of the basal nuclei possibly done. Now, coming to the functions of this basal ganglia. In other words, in easy words, the basal ganglia is basically a refining center. So, whatever the impulses are coming from three different sources like a thalamus or the cerebral cortex or the substantia nigra, they are coming in tons, they are coming plenty. Now, which impulse to take and which is not to take, they are filtered by these nuclei which is present in the basal nuclei. So, they are basically a refining center of these actions or the motor impulses, they are coming from different areas. So, the basic function of this particular basal nuclei is to feedback mechanism. They are motor refining areas. So, impulses coming from the cortex, there are plenty of them. Say for example, 20 impulses are coming. Out of these, the best impulses that is being picked up by this basal ganglia and rest of them are eliminated. So, they are refining these motor things which is coming from the cerebral cortex and prevents the excessive and exaggerated movements. By preventing the exaggerated impulse, by preventing them the exaggerated movements which is coming from these particular different areas of the brain. Say for example, this particular brain have got like a 10 nucleus which is discharged from the cerebral cortex, And if you are counting on 10 impulses or 100 impulses, which is coming from 100 different neurons, it will be bizarre movement. So we cannot do that. So we have to pick up one or strong final impulse which is coming from one nucleus, and counting on it will be just like following the impulse. So this refining function of this picking up this right signal is done by this basal nuclei. So it picks up these particular impulses, which is known as the motor refining, and that's why it is singling down which are the impulse to take and just like act on it and cut down the rest of the impulses, and this prevents the excessive and exaggerated movements of this particular the brain, particular pertinent to the brain. Other than this particular refining movement, it also have an emotional response. So it controls this emotional aspect and the cognitive aspects of these particular neural functions as well. So these are the two functions which is coming on these particular things. So how these things are coming on here? So inflows, they're coming from the cortex, thalamus and brainstem. They're getting into these particular areas of the brainstem nuclei, which is coming in the putamen and the caudate nucleus. From the putamen and the caudate nucleus is going to the basal ganglia nucleus, which is known as the globus pallidus. From the globus pallidus, it is reflected back to the cerebral cortex. Now then the brain reacts to this refining thing to this particular corticospinal tract and the corticonuclear tracts based on how they work. In a single way, if you are just like simplifying how these particular fibers are working, we have this putamen, we have this caudate nucleus. So these are the things which is present inside. Now other nuclei, which is the basal ganglia, which is the basal nuclei has, which is known as the globus pallidus. So we call them as GP. Now, so impulses which is coming from different sources, we call them as inflow of these impulses. So inflow of the impulses, they are coming from three separate sources: cerebral cortex, substantia nigra and the thalamus. So the three different sources, the in-house informations are coming. We call them as inflow. Now the inflows which are reaching to this nucleus, which is related to the putamen and this caudate nucleus only. They are not going to any other system. Now what this putamen and the caudate nucleus they are getting, they are refining it. Once this refinement is done, they are sharing this information with these globus pallidus. Now once this globus pallidus gets the refined thing which is coming from here, they are relaying back to the cerebral cortex. So this globus pallidus, once this thing are getting it from there, and once it have them, it creates the outflow. So it creates the outflow from the globus pallidus towards cerebral cortex. So this particular outflow from this globus pallidus reaching to the cerebral cortex. Now this refined information which this brain is perceiving through the system, the cerebral cortex, through the fibers, corticonuclear fibers plus corticospinal fibers, they are relayed from the brain motor centers to the nuclei system and the spinal cord system, and the motor action is executed. So this flow of this information, getting the information, analyzing it, sharing it with the globus pallidus, then outflowing it to the cerebral cortex through the fiber system, from the cerebral cortex directly influencing it to the centers itself. So once this reaching to the cerebral cortex, motor fibers or motor cortex region, the signal which is now coming from the cerebral cortex is conveyed through these corticospinal tract, corticonuclear tract, going to the nucleus and the spinal cord, and the motor action is now executed is a perfect motor action. So, this refining of these things is, for example, somebody has written a script and shared with you, and you are saying that this script has got this error, grammatical error, script error, whatever it is, that refinement is done and sent back to this particular writer, and then the writer is typing it and printing it. That's the thing, is the main book which you are reading. So, we have a proofreading action which is taken place into here, the putamen chordate nucleus and the globus pallidus, which is the basal nuclei, is basically proofreading the motor actions which is being scripted by these three areas: thalamus, cerebral cortex and the substantia nigra. So, this is the flow of the system, how this particular refining work or the modulations of the motor actions is controlled by this particular basal ganglia nucleus in a schematic way. In a physiology, I believe you may have a better or an extensive understanding on this, but this is in short about how these things runs in this particular basal nucleus system and this. So, this is the thing which is schematically present, which is a little bit difficult to comprehend for me to understand about this. So, just like to narrow it down to this simple form, which is coming from input, inflow, then sharing with the GP, then outflow, cerebral cortex, and this final thing comes out to this particular cortionuclear corticospinal tract. Now, coming to the blood supply. Now, next please. Now, this is the main blood supply which is coming from these particular areas. So, we have an artery which you can follow over here, which is this one. So, we call this artery as a middle cerebral artery, MCA. So, this particular MCA shoots down some branches over here. So, this particular branches which is coming from the MCA, also known as middle cerebral artery, which is penetrating and reaching to this. So, these branches which is penetrating from the MCA, we call them as lenticulostriate arteries. So, these lenticulostriate branches of MCA is supplying this major area of this basal area, or of the base of the brain, or also known as this particular area as a basal ganglia nuclei. So, the MCA branch, which is, if you can remember, the lenticulostriate branches is the prime thing which is supplying. Now, talking about it. Now, MCA or middle cerebral artery rupture or infarction is the commonest thing what we see in our clinical life. So, whenever the patient is coming with this cerebrospinal cerebral stroke or CVA, we see a bleeding is coming from this region more commonly over here, and the patient is losing most of the motor function or refined motor actions. So, this branches is most commonly we see that either rupture or thrombose and leading to the CVA. Alright. So, this branches, lenticulostriate arterial branches, which is MCA territory supply, which is the prime supply to this particular basal nuclei or basal area. Along with that, we have additional artery which is coming on the anterior part, which is lying over here, which is coming from the anterior cerebral artery and anterior communicating artery, which is a part of this circle of Willis, which is supplying the head area of the chordate nucleus, which is present in here. So, this particular chordate nuclei head part is supplied with the anterior cerebral artery and anterior communicating artery, and rest part is supplied by this MCA lenticulostriate branches. পিছনেরটা যাও তো, পিছনেরটা যাও তো. Now, if you're going down to this particular substantia nigra supply, the substantia nigra is supplied by this artery which is lying on the posterior side, which is supplied to the posterior cerebral artery or posterior communicating arteries, which is forming the posterior part of the brainstem. So, three different arterial sources is supplying from three different regions, supplying the entire brain region. The major supply is of course MCA, lenticulostriate branch. That's a common artery which is thrombosed or ruptured. In most of the clinical cases we see that and affecting this region. Other is the anterior cerebral artery or anterior communicating artery, which is supplying this particular area, which is like the head of the chordate nucleus area, and the posterior part, which is the brainstem region, substantia nigra. That part we supplied by this particular posterior cerebral artery. Now, coming from the vasculature, moving to this particular disorders of the brainstem or a basal ganglia region. And prime importance over here is of course the Parkinsonism, which is like an exam question all the time. We see this is coming from this particular first one, like a mid one to like a final semester. We see this particular Parkinsonism is coming, which is a failure because of this particular like substantia nigra. The cell bodies of that it may be destroyed. Maybe the fibers which is coming from the substantia nigra and ending on the striatum, nigrostriatal path, which is carrying fibers or which is the road through which this dopamine is reaching on that part, is depleted, or both of them, maybe just like nigra, all this particular nigrostriatal tract may be destroyed, chemical destruction, physical destruction, or a vascular, or any reason we have this particular loss of this particular dopamine, which is regulating this particular inhibitory response in this region. That's what we're seeing there. Everything over here is cut down by this particular guys, is not controlled by this particular dopamine, then we are not filtering the responses. That's why that's the thing which is happening in case of this Parkinsonism. Too much influence is coming, and we are not screening it down which one to take and which one is not to take. That's why it is leading to the clumsiness of the movement. Yes, right, no, left. That's the thing which is happening. Too much of influence is coming, leading to this particular problem. So this is the prime problem of the basal ganglia. We call them as movement disorder, and along with the muscle tone disorder. We have the diseases which is linked to it. It's Parkinsonism, chorea, acidosis, hemibalismus, different kinds of like motor dysfunction or the movement disorders. And out of that, Parkinson is a big key. So that the things we have to mention about why these things is happening, where is the trouble, like what is bringing this particular insert to this particular problems. So this is in short about this particular basal ganglia and the clinical aspects. You have to know this particular structural basal ganglia component of the 3 nuclei there. Then we have the functional 2 additional to it. Then if you are classifying it based on this input nuclei and output nuclei, then also it can be classified accordingly. I have to know a little bit about each of these components, like how these particular nucleus are placed and separated between them, what are the fibers which is present to it, blood supply to this particular region and over these regions, connections of course, afferent fibers, efferent fibers, and how these afferent efferent fibers are controlling the entire mechanism of the motor networking system, which is nothing but the refining of the motor system. Along with that, it has a contributory element to the cognition part or thinking or memorizing part, as well as the emotional discharge as well. And this Parkinsonism, of course, this is a house of importance which you have to know about, this basal ganglia and Parkinsonism, how these things are related to it. Now from there we are going to talk about this particular midbrain, as we are mentioning over here about the substantia nigra. So these things will be covered in maybe Monday or it will be covered in Tuesday lecture maybe. Now we are talking about the substantia nigra. The substantia nigra is a collection of the black collection body which is seen in this midbrain region. So midbrain section and sectioning of this particular midbrain, we are seeing this particular region. So the substantia nigra, which is the cell bodies are present within this midbrain region, and these fibers are coming to contribute to this particular region on the brainstem, from the brainstem to this particular telencephalon region. So talking about this particular midbrain, it can be split into 2 parts, the tectum and the tegmentum, which is the lower part and the upper part, making a horizontal line around this cerebral aqueduct. And then this particular tegmentum is separated from this cross cerebri by the substantia nigra, which is a black collection body which is present to it. So this is how the substantia nigra is placed. So again, as I am mentioning, this basal nuclei is not only placed inside this particular cerebrum only, it is scattered from this like telencephalon or the brain itself or to the brainstem as well. And coming from this region, you are going to study, next one please, the different sections of the midbrain. This will be covered in next day lecture. So the brainstem, we ask you to draw pictures about the different cut sections of the brainstem. So this particular brainstem cut section, which involved the midbrain region, we have 2 cut sections on the midbrain region. One cut section is done at the superior colliculus level, other one is present at the inferior colliculus level. So these 2 pictures we have to prepare, because we see the questions are coming on it, and we ask you to draw and label diagram about these particular areas of this brain region whenever you are just like asking about or drawing picture of histological picture of the brainstem midbrain region. So this will be covered like in the next lecture for discussion as well. So I'm just like introducing it about this particular substantia nigra which is present in this region, which is a part of the basal ganglia, and this functional part which you already have discussed, which is closely linked to the disease part, which is like Parkinsonism, and this like a dopamine synthesis and the pathway tax which is related to it. We all be discussing about more about this in the Tuesday lecture. So that's all for now.